Hello and welcome. Today we'll be discussing a critical and often life-threatening heart condition, aortic dissection. This is a medical emergency that requires immediate attention. Understanding what it is, its causes, and how it's treated can potentially save lives. Aortic dissection occurs when a tear develops in the inner layer of the aorta, the body's largest artery. Several factors can weaken the aortic wall, making it susceptible to this tear. High blood pressure is the most common culprit, placing immense stress on the aortic lining. Other risk factors include genetic conditions like Marfan syndrome and Ehlers-Danlos syndrome, which affect connective tissue. Trauma to the chest, such as from a car accident, can also cause a dissection. Additionally, pre-existing aortic aneurysms, certain heart conditions like bicuspid aortic valve, and even pregnancy can increase the risk. The aorta is composed of three layers: the intima inner layer, the media middle layer, and the adventitia outer layer. In aortic dissection, blood surges through the tear in the intima, separating the intima and media. This creates a false channel within the aortic wall. As the blood flows through this false channel, it can extend along the aorta, potentially disrupting blood flow to vital organs and causing life-threatening complications. The consequences can be dire, including stroke, heart attack, kidney failure, and even death. While aortic dissection is relatively rare, it affects people of all ages. It's more common in men than women, and is most frequently diagnosed in individuals between 60 and 70 years old. However, younger individuals with genetic predispositions are also at risk. It's estimated that several thousand cases occur annually in the United States, highlighting the need for increased awareness and prompt diagnosis. The symptoms of aortic dissection can be sudden and severe, often mimicking other conditions, making diagnosis challenging. The most common symptom is a sudden, intense chest or upper back pain described as tearing, ripping, or stabbing. Other symptoms may include shortness of breath, loss of consciousness, weakness or paralysis on one side of the body, difficulty speaking, a weak pulse in one arm compared to the other, dizziness, abdominal pain, and leg pain. Because these symptoms can overlap with other conditions, it's crucial to seek immediate medical attention if you experience them. Diagnosing aortic dissection requires a high degree of suspicion and rapid imaging. Several diagnostic tools are used to visualize the aorta and identify the dissection. A CT angiogram is often the first-line imaging test, providing detailed images of the aorta. Other options include an MRI, which offers excellent soft tissue detail, and a transesophageal echocardiogram, a TE, where an ultrasound probe is inserted into the esophagus to get a close-up view of the aorta. These imaging techniques help doctors confirm the diagnosis, determine the location and extent of the dissection, and guide treatment decisions. Aortic dissections are typically classified using two main systems, the Stanford and DeBakey classifications. The Stanford system is more commonly used and categorizes dissections into two types, type A and type B. Type A dissections involve the ascending aorta, the part closest to the heart, and are considered surgical emergencies. Type B dissections involve the descending aorta and can sometimes be managed medically, although surgery may still be necessary in certain cases. The DeBakey system categorizes dissections into three types based on the origin and extent of the tear, but the Stanford system is generally preferred for its simplicity and clinical relevance. Treatment for aortic dissection depends on the type and location of the dissection, as well as the patient's overall health. Type A dissections typically require immediate surgery to repair the aorta and prevent life-threatening complications. The surgical procedure involves replacing the damaged portion of the aorta with a graft. Type B dissections may be managed medically with medications to lower blood pressure and heart rate, reducing stress on the aorta. However, surgery or endovascular repair, involving the placement of a stent graft within the aorta, may be necessary if complications arise or if the dissection is expanding. Long-term management includes regular follow-up appointments and imaging to monitor the aorta. Preventing aortic dissection focuses on managing risk factors. Controlling high blood pressure is paramount, achieved through lifestyle modifications like diet and exercise, as well as medication. Individuals with genetic conditions like Marfan syndrome should be closely monitored by a cardiologist and may require medication to reduce stress on the aorta. Avoiding smoking, maintaining a healthy weight, and seeking prompt medical attention for chest pain are also important preventative measures. The prognosis for aortic dissection depends on several factors, including the type of dissection, the speed of diagnosis and treatment, and the patient's overall health. Untreated aortic dissections are almost always fatal. However, with prompt diagnosis and appropriate treatment, survival rates have improved significantly. Long-term survival requires ongoing management of risk factors and regular monitoring to detect any potential complications. Recent research is focusing on identifying new genetic markers for aortic dissection, developing less invasive surgical techniques, and improving long-term outcomes for patients. These advancements offer hope for better prevention, diagnosis, and treatment of this complex and challenging condition. Thank you for joining us today.